radiography is defined as those intraoral radiographic techniques taken during an X-ray set where the image receptor, film packet or digital phosphor plate is placed in the occlusal plane. The same thing, digital phosphor plates are used in the occlusal plane. The head position should be parallel with the floor, and the image technique is taken intraorally. The second slide is exactly, this is that bookish thing. The subclassification is, there are two types of X-rays taken, maxillary and mandibular. The subclassification includes upper standard for the anterior part of the mouth, oblique for the side of the upper anterior teeth. The oblique occlusal X-ray covers mostly the posterior part of the mouth, upper maxillary, and the upper standard is used for the anterior part of the mouth. We have vertex occlusal, which is no longer used. Then the mandibular occlusal projection, it is used for the mandibular ones. The X-ray is taken from the mandibular side. The collimator is used for the 90 angle projection, and it mostly covers the mandibular part of the mouth. There are two types. True occlusal, just like the upper standard one, which is taken lower at 90 occlusal plane. The second is the lower 45 degree, and then is the lower oblique occlusal, which is taken behind the angle of the mandible for the submandibular glands and for the third molars, right? The upper standard or anterior occlusal is taken for the maxilla and upper part of the anterior teeth. The indications are a periapical assessment of the upper anterior teeth. It is used mostly in children who are not able to tolerate the periapical holders, detecting of the present unerupted canines, supernumeraries and odontomes. And the third is determining the bucco or palatal positioning of the unerupted canines and evaluation of the size. These all are indications or uses of the upper occlusal technique, which is taken from 90 degree upwards, and the indications are used for those children whose upper anterior teeth X-ray is required and they are unable to tolerate the periapical X-ray view technique. The other is for the detection of unerupted supernumerary and odontomes, and the third is for the unerupted canines and cyst and tumor detections, and for the assessment of fractures of different alveolar bone and the anterior. Technique and positioning is the same as we read in the book. The X-ray is taken upwards at right angle, and the patient is seated horizontal, and the mouth should be parallel to the floor of the floor, and a thyroid shield is used for protection and support. The second is the image receptor suitably barrier wrapped is placed flat into the mouth onto the occlusal surface of the lower teeth. The patient is asked to bite